Hey HSI family, I'm Shelly Simone, mental health professional, and we are here to celebrate Black History. Our behavioral health and recovery specialists came together to have an honest conversation about mental health with our medical director, Dr. Jackson. If you don't know, Dr. Jackson is a forensic psychiatrist, published author, and a true representation of our theme, Unapologetically Black. Our HSI family brought real questions to the table, the kind of questions that reflect the work we do here every single day. So let's hear what Dr. Jackson had to say.
Good afternoon, beautiful people. How are you today?
Good. How are you?
I'm doing well. I'm so happy that you all have chosen and given me the privilege to sit and talk with me and chit-chat about mental health and our roles and our dedication to the community as part of HSI. So I'm very excited to see you all in this capacity, but I enjoy working with you all every day in different capacities as well.
Thank you.
Absolutely. So, Dr. Jackson, my name is Bree. I'm a behavioral health care manager here at HSI. And my question for you is, resilience in the Black community is often praised while the systems that cause harm goes unchallenged. What needs to change so that resilience is no longer the expectation placed on Black communities, but a choice supported by equity, healing, and real opportunity?
That's a great question. So first of all, resilience itself is an innate response for the African American community. We have learned to be resilient from the beginning of time, so to speak. Being able to survive different adversities and being put in a position where you don't necessarily have a fair stake in the game, in whatever game that is. So there's a saying that, sometimes we are not given an opportunity to be at the same starting point as other counterparts. It's also important that we first and foremost recognize that we need to make sure that we have the representation in all aspects of the career paths, if you will, particularly in mental health. Having individuals that look like us, that come from where we come from, that have similar experiences, can sometimes have not only just a certain level of empathy, but I think it also allows individuals to be able to have the opportunity to say, that can be me. It is possible. But resiliency is one of our strong suits.
Thank you.
Absolutely. That's a great question.
My name is Irvin Freeman. I'm the program supervisor over at Mike's Empowerment House. So my question to you, Rand, if you had a client who witnessed a violent event, like a friend being shot, and during that kind of trauma, what diagnostic parameters or framework would you use to assess them? And how would you approach understanding the psychological impact from a forensic context?
The diagnostic framework I would use would be the diagnostic framework I would use, generally speaking, for any patient that I'm seeing as a psychiatrist. It's important to understand who that person is, what's going on, where they're from, and, just sort of understanding their biopsychosocial framework so I can understand who this person is sitting in front of me at this time. The second component of that is then we can start assessing, history, psychiatric history, social history, which does include those particular forms of trauma. So that would be that approach. Now, when we talk about trauma and how we assess that and how we address that, I think we have to look through trying to understand first that person's perspective. And in order to do that, you have to be a thorough, active listener, okay? You have to be patient to listen and understand what's going on in their world and try to understand how they have been navigating in their world and now what they are doing since they have experienced such a traumatic event. Usually individuals that are in communities are ridden with gun violence and negligence and lack of resources, and there are a lot of layers to try to work through and then ultimately try to address how they deal with those particular traumas. Unfortunately, there are individuals that have, as a coping skill, become numb to that sort of violence because now it has become a routine for them. So I think first and foremost, with any provider or anybody that's in the mental health care field that has the privilege to speak with somebody who was courageous enough to even come and speak with them about it, you fundamentally have to first have patience. Just being able to sit down and talk to somebody that is going to have enough empathy, if you will, to listen to them, I think there's always hope for that person and anybody else going through that type of struggle and trauma to live through it and still have a fruitful and prosperous life?
Thank you for
You're welcome. Absolutely. That's a great question. Absolutely.
Okay. Hi, I'm Jasmine Rodriguez, Peer Recovery Support. And my question for you, Dr. Jackson, is, as a psychiatrist, how has your work helped break barriers in mental health care for the Black community?
That's a great question. So it's my role as a psychiatrist has helped in many ways. I think fundamentally, I have always been on a crusade, if you will, with fellow colleagues that are not of African American origin to understand what we call the Black plight. One of the things I really make sure that I do throughout my career thus far is educating my colleagues on understanding the cultural differences of the African American community. It's always been important for me for colleagues to understand what some of that language is. So if someone says, man, they got me all messed up and, they're just fighting in my community and people shooting and, it's just a lot going on. I don't want to even go outside. And I'll have colleagues say, well, they're paranoid and this is paranoid schizophrenia. But again, are you taking the time to really listen and understand what's going on and how they are communicating and what they're not communicating? Because in my line of work, you still have to be astute enough to know what questions to ask, even if they're not being asked. You still have to have intuition to understand what they're trying to say, even through their behavior and their facial expressions during the evaluations. So it's very important to me in that respect that I, help my colleagues understand this is what we need to be looking at so that we are also not misdiagnosing African Americans with mental illnesses that they do not have. Yes. I would like to take this time to thank you all for your time and the questions that you asked, the fact that you all have dedicated yourself as public service to this community. It sends so many different positive messages out to everybody. So continue to fight the good fight. Appreciate you guys.
Thank you.
Absolutely.